And ladies and gentlemen, we do appreciate your patience. Welcome to Senator McGuire and the Mendocino conference call. At this time, all participants are in a listen-only mode. If you should require assistance during today's call, please press star, then 0. As a reminder, this conference is being recorded. I would now like to turn the conference over to our host, Senator McGuire. Please go ahead, Senator.
Hey, good evening, Ray. Thank you so much for all of your help tonight. We're grateful. First and foremost, I want to say welcome and thank you all for joining us for our Mendocino County Town Hall focused on California's coronavirus response. We want to remind you that you can, in live time, email us your questions. Please email senator.mcguire@senate.ca.gov. In real time, email your questions for tonight's town hall to senator.mcguire@senate.ca.gov. My name is Mike McGuire, and I'm honored to work with you as Mendocino County's state senator. We have an incredible panel joining us tonight. But before we get into it, I want to just say a few opening remarks. I hope that you would agree with me that the last 5 years in Mendocino County and the North Coast has been more than challenging. We've been devastating by fires. We've gone through the power shutoffs together. Our transition to a legal cannabis market has been bumpy, to say the least. We've had our crab fishery collapse, and now this virus. I don't know what you think, but sometimes in the morning I think it's a bit surreal. And one disaster would be big enough for any community, but Mendocino County has been able to withstand it all. And I can't tell you how impressed I have been with the people of Mendocino County and your local government leaders. I am incredibly heartened by the kindness, the hard work, the community spirit, the can-do attitude that exists right here in the county. And if the true measure of someone is how they respond to a crisis, then Mendocino County is truly a remarkable place to live. And I'm grateful to be working with you. Before we get into tonight's town hall, I'd like to be able to introduce our speakers and go over the flow for this evening. Number one, I'm going to provide you a brief update on coronavirus response from the state of California. Secondly, we're then going to turn it over to Dr. Brewer from the UCLA Griffin School of Medicine. He's going to give us a 30,000-foot view of the virus. He's going to briefly describe what it is, talk about the shortage of tests and why we're seeing that in America. And he's going to be focusing on the best ways to be able to control the virus and why shelter-in-place orders actually work. We're then going to turn it over to the County of Mendocino to give us a comprehensive update on coronavirus response in the county. We're going to hear from our county executive, Carmel Angelo, and the Mendocino Public Health Officer, Dr. Duhan. We have just learned that we have the first confirmed coronavirus case in county. Dr. Duhan will be describing that. She's going to be talking about the current status of preparations, what to expect in the coming 30 days, and she's going to also describe the shelter-in-place order that has just been issued for all Mendocino County residents. We're then going to hear from our hardworking County Superintendent of Schools, Michelle Hutchins. The County Superintendent of Schools is going to be focused on the closure update for all schools in Mendocino County. She's going to be talking about distance learning, and while schools may be closed for students, the education is going to go on. She also will be talking about school meal distribution for our county's neediest kids. I'd like to transition, though, to the state of California at this point, and here is where we're at now. We must take dramatic action across California to lower the cases of infection of coronavirus. As of 6 o'clock this evening, we're just under 600 residents who have the coronavirus. They've tested positive. We are very focused on lowering the number of infections across the state. And there's two concerns that the state of California currently has about the number of infections. Number one, we have to ensure that hospitals and health centers are not overwhelmed. We're seeing anywhere between a 20 to 25% increase in cases, confirmed cases, each day. We originally thought that hospitalization rate of total cases would be around 5%. We're currently predicting anywhere between 7 to 10% hospitalization rate for those who have the coronavirus. That is why we need to lower the curve. We need to slow the rate of infection. The second reason why We need to slow the rate of infection. We need to keep the fatality rate low here in California. 80% of those who catch the virus here in California will display little to no symptoms. That's good news. The bad news is individuals do not know that they're infecting their neighbors and their families. And we ultimately believe that over half of California's population could catch the coronavirus here in the coming 60 to 90 days. Look, this is an unprecedented event, and this crisis will be with us for the next few months. And this crisis is unlike none of us have ever seen in our lifetime. And I want to be honest about that. We know that there are challenging days ahead, but we're coming together in the Golden State like never before. The legislature just 2 days ago passed a unanimous bipartisan spending bill that will invest $1 billion to be able to expand hospital capacity across this great state. We'll be reactivating 2 formerly shuttered hospitals and purchasing surge equipment to help expand patient care in hospitals and health clinics across California. The funds will also help nursing homes proactively protect elderly and medically vulnerable populations, and the dollars are going to assist local governments to reduce the spread of the virus in homeless populations, one of the highest risk populations in the state. Through an executive order, the state has moved to be able to protect renters and homeowners in this unprecedented crisis. The order authorizes local governments to halt evictions and slow foreclosures and protect Californians from utility shutoffs. This order is in effect through May 31st. We have waived the 1-week waiting period for unemployment. Individuals who are unemployed due to the coronavirus should seek unemployment benefits through the Employment Development Department. And we've just received word from the federal government that small businesses, nonprofits, and individuals will be able to seek financial assistance and low-interest loans from the Small Business Administration. We'd be happy to be able to provide additional information on this later in the call. I think it is now time to be able to get into our coronavirus preparedness town hall, and we are so grateful that we have one of the best on the line tonight. His name is Dr. Brewer. He is a member of the Division of Infectious Diseases at the Geffen School of Medicine at UCLA. He's going to be giving us that 30,000-foot look at the coronavirus across the state. Dr. Brewer, we welcome you to the town hall. The floor is yours, sir. You have 5 to 7 minutes, and I'll give you a 30-second heads up. Dr. Brewer.
Thank you very much, Senator McGuire, and thank you for that terrific introduction. And you're exactly right. We need to take this very seriously, and let me explain why. So first, what is this? COVID-19 is a coronavirus. A coronavirus is a respiratory virus, the same kind of virus as influenza, which you're probably all very familiar with. And it spreads exactly the same way. However, this particular virus has an important difference. It's an animal virus that managed to get into people. And what that means is nobody has immunity to this virus, and so we are all potentially susceptible to getting infection. The other important difference between this coronavirus and a typical flu virus that you're probably used to is that in a typical flu season, about 1 in 1,000 or about 1 in 2,000 people will become sick enough where they may actually die from influenza. In contrast, unfortunately, this coronavirus is so severe that about 3 to 4% of people who become infected can potentially die. And I'll talk a little bit more about that in a minute. But that's why the state of California, the federal government, and everybody else is taking it so seriously. That's why the World Health Organization declared a public health emergency of international concern, and President Trump declared a national emergency on March 13th. So the senator is exactly right. We do need to take this very seriously. So this virus has rapidly spread around the world. It's now reported in over 150 countries. Globally, there have been about 200,000 cases and a little under 8,000 deaths. So we're still kind of early on it. Here in the United States, we've had about 7,100 cases and under 100 deaths so far, 97 deaths. California is about 598 cases and 13 deaths. And as we just heard earlier from the senator, there's been one case so far in Mendocino County. So what actually happens if you get this? Well, so most people will have a fever and dry cough. You could potentially have sore throat, myalgias, and some diarrhea. And usually it takes about 4 to 6 days from the time you're exposed to the time you get sick. As the senator mentioned, the vast majority of people will do just fine. So about 80% of people will have mild or moderate disease. It will just be like a flu for them. About 15% globally are sick enough to end up in the hospital. And as Senator McGuire pointed out, we want to get that number much lower. That's a high number. And about 5% are sick enough that they actually need to be in an intensive care unit. The good news is that children and young adults are much less likely to have serious disease. So that, for example, if we look at data from Italy where they've had over 22,000 cases, they've had no deaths in anyone under the age of 30. This does not seem to be a serious disease for children. And in fact, if you look globally at people under 50, the mortality rate is under 1%. So who do we have to worry about? Basically, we have to worry about our older individuals, particularly those with heart and lung disease, diabetes, and other medical problems. So, for example, if you look at people over the age of 70, the mortality rate if they get sick is around 13%. So really we want to be focusing in part on protecting our older population. And more good news is, at least based on limited data, there doesn't seem to be any evidence that pregnant women spread the COVID infection to their developing fetuses. So COVID-19, like flu, is spread by people who cough and sneeze. And generally, this is close contact. And what do I mean by that? I mean that you need to be within 3 to 6 feet of someone who's coughing or sneezing. We think that the people who are most ill are most likely to spread COVID-19, but people who are asymptomatic can spread it. Now, when somebody's coughing or sneezing, they could cough or sneeze on a table, a counter, some other object where the virus could be found. And that virus can live on that surface anywhere for a few minutes to hours to even a day or more. That's why it's so important to wash your hands after touching surfaces and to keep those surfaces clean. The good news is this is not a party virus. So typical soap and water, routine cleaning products are fine. You don't need to go out for any special products or any special cleaning. But you will want to make sure you're keeping your countertops and door handles and things like that clean, washing your hands, especially when you cough or sneeze, and making sure that you cover your nose with your elbow or a tissue if you have to cough or sneeze. And then finally, I just want to say that data coming out of countries like China and South Korea are showing that they've actually been able to bring the virus under control. So as I mentioned earlier before the call, the New York Times is reporting that China actually has no new cases of coronavirus about 6 weeks after they started their control efforts. Dr. Duhan's going to talk more about those later on. But I do want to leave you with the hope that these very important control measures, which we will be talking about, can actually make a difference. Thank you very much, Senator.
Dr. Brewer, we are so appreciative of your comprehensive overview, your update. I know that you are going to be sticking around for questions. And again, Dr. Brewer, thank you so much for your partnership. Dr. Brewer is actually on the front lines of this at UCLA Medicine, treating fellow Southern California neighbors. And I just want to say thank you for all of your work and your colleagues as well, sir. We are now going to be moving on to be able to get a comprehensive update from the County of Mendocino. We are grateful that the County Executive Officer, Carmel Angelo, is here. We're then going to turn it over to the Mendocino County Public Health Officer, Dr. Naomi Duhan. Madam County Executive, we welcome you to the Town Hall. Thank you, your team, for all of your work. We got some long days ahead, but we know that you are just digging into this and making sure you're keeping residents safe. Madam County Executive, the floor is yours.
Thank you, Senator, and thank you to your team as well for all the work that they've done and their assistance with us. We have had a few press conferences over the last couple of weeks, and your staff have been available and have attended our press conferences to represent you. So thank you for that. Thank you for the Town Hall and the opportunity to yet again let the public know what we're doing. I would like to say that we have a workforce of 1,200 employees. They are not 1,200 county employees. They are 1,200 disaster service workers and 1,200 public servants. And I think that with an opportunity like this, with COVID-19, we are able to show the public that we are public servants, we are disaster service workers, and we're there to serve the public. At this point in time, we are looking at our services versus essential services and what the county needs to do to keep the essential services, emergency services, and 24/7 facilities going. So right now, as we embark on attempting to protect the public's health and safety, we have moved forward with a fully operational emergency operations center, and all of the departments within Mendocino County are working together to respond to this public health event. As you mentioned earlier, over the last 5 years, this region has had a myriad of events that have afforded us the opportunity to get better and better at response with our fires, with our public safety power shutoff, and now with the public health event, COVID-19. So we have been working together in support of public health, in support of our public health officer to respond to the public needs and to prepare. You will hear more from our public health officer, Dr. Duhan, about the work that's been done in the county, within the county system, and working with the community since January. We have not slacked on this. We have attempted to get in front of it. And unfortunately, because the Bay Area has really been the hub here in the state, we have been able to learn from the Bay Area and try to get in front of this illness or virus as best we can. Our concern about the health and safety of our public has created yet one more time a very good alliance between Health and Human Services, the Executive Office, and Public Safety. Our sheriff has been right there with us to assist the health officer in anything she needs. We're currently working with the business community regarding the economics. We know that something like COVID-19 could shut down the county. So we are doing a lot of work. We had a phone conference with the business community today, and we have another one set for tomorrow. So regarding the statistics and our status of preparation and preparedness, Dr. Duhan will talk about that. So the last comment I would like to make, Senator, to our residents in Mendocino County is just like the fires and just like public safety or the public safety power shutoff, Mendocino County was there to serve the public. Our doors were open. We're here to serve the public today. We'll be here to serve the public tomorrow. We are looking at closing the offices to foot traffic, but having staff available to take calls and to respond as necessary. We just have to protect our workforce just like we have to protect the public. So, again, thank you for the opportunity to participate in this town hall to talk about Mendocino County and the efforts that we're doing to protect the public regarding COVID-19. And at this point in time, I would like to turn it over to our health officer, Dr. Mimi Duhan.
Thank you so much. We're grateful, Madam County Executive. Dr. Duhan is going to be covering the shelter-in-place order and the notice that was recently sent out, what that means for Mendocino County residents. She'll talk about the confirmed case, what to expect in the coming 30 days, and obviously best practices for preparedness. Dr. Duhan, you have 5 to 7 minutes, and I'll give you a 30-second prompt. We welcome you to the town hall. The floor is yours.
Thank you, Senator. And I want to thank you, Senator, for showing up again and again for us in Mendocino County. You know, here in Mendocino County, you do such a great job representing us, and part of that is helping to get information to our county. We are a rural county. People are spread far apart, and in this town hall, I'm really hoping that the listeners are getting the needed information that will help them get through the next 30 days with confidence that we're working for you and we're leading for you. So we have a great team representing us here at Public Health on the ground here in our EOC, but we also have some leaders that I want to share with our listeners who are advising us day to day and are really helping us make the right decisions for our county. One of those is Karen Smith. She was the Director of Public Health for the state of California under Governor Brown, and we're so fortunate to have her as a consultant and a mentor to me, and she has been also advising in Santa Clara. And what's really been important to me with regards to that is that she's been teaching us about what's going on in Santa Clara and giving us the opportunity to really get ahead of the curve, get ahead of the wave, and try and slow it down so that in Mendocino County we have a chance to have, you know, a softer landing when this wave hits us. I know it will hit us, but we've had some time to prepare, and we've been working very, very hard in that time. For example, we're prepared to do the standard epidemiological work with this first case. We have tests from our public health lab in Santa Rosa that we'll be able to do tracings in terms of looking at who this first case was in contact with and to make sure that any other contacts that come out of this case are also put in isolation. I can't tell at this time. We just got the news about the first case. I can't say specifics about it at this time, but I will share that the clinic where this patient was seen handled everything perfectly. They wore their personal protective equipment, so they protected their healthcare workers. They screened properly. They did the COVID-19 test, which they reported to us immediately. And as I promised to the press, we announced it to the press within less than an hour of our learning about the case. I will say about this individual that it's somebody under the age of 30. They are healthy. They did not need to be hospitalized. They are in isolation, and they look like they're doing well. So we will be following up on this case tomorrow. We just found out about it today, but we know that the individual is in isolation, and we are doing what we can to do that important containment piece, the epidemiological work to follow up. The other piece that I want to share is what we're doing and working hard to do around mitigation, and that's to lessen the impact of this infection on our county. We are working on alternative housing so that our individuals who are in congregate settings like jails, like homeless shelters, we have a winter shelter right now, or frail elderly in skilled nursing facilities, have places where they can safely be isolated if they're not sick enough to go to the hospital. We've been doing really great work in that area, and I'm hoping and confident that we'll be able to make some announcement in the coming days. I actually met with the jail today, Captain Pierce at the jail, and our sheriff, and there are plans in place in our jail to make sure that our arrestees can be safely isolated if we were to have any cases in the jail. One of the things that we are prepared for, that we are really aware of, is that as the universities have closed across our nation, our students are coming back to California and to Mendocino County, and we're really working on messaging about how when those students get home, they need to protect the elders. Part of that is our shelter-in-place order, which just came out tonight. We started with a shelter-in-place recommendation 2 days ago that was closely modeled after the Association of Bay Area Health Officers, who all released their shelter-in-place order on Monday. We started with the shelter-in-place recommendation and then released the order today. I will want to give a couple highlights about that order. In particular, we worked very hard to make sure that the essential businesses that we define in this order reflect our rural community. The order says that individuals should shelter in place unless they need to leave their home for reasons related to their essential work or to participate in interacting with essential businesses. Some of those essential businesses that I want to highlight for our rural county are that we are calling essential businesses that supply products which would enhance the quality of life of members of our community while sheltering in place. And we also mentioned that these quality of life items, they may be sold only to the extent that they are purchased in a way that prevents handling by the customer prior to purchase, such as curbside pickup. So we know that in our rural community, unlike the Bay Area where we have big malls and we have people, living in more crowded environments, we're more spread out. We don't have malls. We have single small businesses that may be able to comply with this curbside pickup. And that way, when we have people sheltering at home, they'll be able to increase their quality of life, say, by picking up a book at the bookstore or picking up, materials so they might be able to do some gardening at home. We also are going to, of course, support our businesses that are involved in ranching and farming and agriculture. So this was a very important nuance and element to our shelter-in-place orders, which otherwise very closely follow the Bay Area. One of the other things in our order is that skilled nursing facilities are prohibited from allowing visitation with their residents unless the resident is experiencing end of life. And while this is as a family doctor, as a hospitalist and primary care doctor, this was a very heartbreaking element for me actually to put into this order, but this is in acknowledgement of what happened in Seattle, where so many people in nursing homes, lost their lives, and it's also an effort to protect our healthcare workers. I want to say to our listeners what to expect in the next 30 days.
And Dr. We have about 1 minute, and we can always come back to that, but I want to also get to the superintendent. We can come back, but please continue.
Sure. Yeah, so this order goes into place on April 7th. We will get through this together. There's a great deal of hope and strength in our community, and I, as your public health officer, will continue to work day and night through the next 30 days to serve you. That's it, Senator.
No, thank you so much, Dr. Duane. We will come back to the doctor here. We have a lot of questions that are coming in right now. We've received about another 34 questions over the last 20 minutes. If you'd like to be able to submit a question, please go to your email, senator.mcguire@senate.ca.gov. We are now going to turn the town hall over to our county superintendent of schools, Michelle Hutchins. She has had a unified approach with all superintendents in each of the districts across the county on all issues of closure, how distance learning is going to work, as well as school meal distribution and that planning and the logistics. We're going to turn the floor over to the superintendent. Madam Superintendent, you have 5 to 7 minutes, and then we're going to open it up for our emailed questions. The floor is yours, Ms. Hutchins.
Thank you. This is Michelle Hutchins, Mendocino County Superintendent of Schools, and I am honored to speak collectively for our school leaders. As we watch COVID-19 spread across China, Europe, and the rest of the world, we knew it would eventually arrive at home. Although we began preparing weeks ago, it's been an enormous challenge to shift to a whole new service delivery model. To flatten the curve and safeguard as many people as possible, we're following the advice of our public health officer to reduce face-to-face contact throughout our communities, which includes switching to remote instruction in our public schools. Remote instruction means that students do not physically attend school, but instead receive and complete lessons at home. Our school districts are quickly implementing a whole new approach to teaching by creating instructional materials online and in paper format to keep students engaged in learning. This is a big undertaking with very little lead time, so we all need to be patient as we work out the kinks. Our school districts continue to provide meals to all students by supplying bagged meals at schools and by delivering them to many bus stops. We are utilizing company vehicles to deliver resources to homeless and foster youth. Many districts are coming up with creative solutions to deliver educational materials while maintaining appropriate social distancing. Some are planning for Monday morning drive-through packet drop-off and pickup. Each school is developing their own process, and I am very impressive with the dedication that these school leaders are putting into what's going on at the individual schools. Mendocino County Office of Education has canceled all classes except our adult night classes that are training medical assistants and phlebotomists. We're dividing these classes into cohorts smaller than 10 and respecting social distancing recommendations while we train the medical professionals our community is likely to need in the coming months. Otherwise, all MCOE employees are working from home and only staff who perform essential functions such as payroll are coming into the office. We'll never know if closing schools slowed the spread of COVID-19, but we must do all we can to make it possible for our healthcare system in this rural community to keep up with the demand. MCOE will remain in contact with our public health officer and collaborate with our local school districts to keep children and our whole community safe. It's time for all of us to think about the greater good, to adhere to our public health recommendations, inconvenient as they may be, in hopes of safeguarding the most vulnerable among us. I thank you, Senator McGuire, for allowing me to join you tonight.
Superintendent, thank you so much. We are grateful that you are with us. Ladies and gentlemen, we are now going to be turning the town hall over to each of the presenters. We have literally dozens of questions that are coming in. We will keep, we have this line for about another 20 minutes, and we're going to try to get to as many questions as possible. We're going to ask that each of our presenters try to keep their answers as efficient as possible. This first question is for Dr. Brewer. Dr. Brewer, if someone has coronavirus, are they now immune? This is coming in from Karen. If someone has coronavirus, are they now immune? Dr. Brewer?
So our belief is that if you've had coronavirus and you recover, you will be immune, but it's too early in the epidemic to know that for certain, but that is what we believe will happen.
Thank you so much, Dr. Brewer. This next question is going to go to Dr. Duhan. This is in regards to the bandwidth of Mendocino County hospitals and health clinics. Dr. Duhan, can you talk about the steps that both Adventist Health and health centers across the county are taking to ensure the spread of the virus is limited? This question came in from Carrie.
Yeah, so quickly, as a health officer, but also as someone who's worked as a doctor in the Adventist Health System, as a hospitalist and also in clinics, I'm very familiar with the healthcare system, and I'm impressed. There are surge tents up in front of the hospitals ready to accept additional patients. I'm impressed by the clinics and how well they've been doing at screening patients and actually setting up their own, version of drive-by testing for the patients that are assigned to their clinics. I've been very impressed by the engagement of the clinicians and how they are really educating themselves on this rapidly evolving pandemic and how engaged they are with me. So there's a great deal of partnership, and I believe that we have 3 hospitals. One is 49 beds in Ukiah, and then we have 2 critical access hospitals. They've been working very, very hard to prepare and to respond. So we are doing our best, and if we continue to, have these mitigation efforts, we won't get the impact on our county that might overwhelm our hospitals. That's what we're working towards, to not overwhelm them.
No, you're absolutely right. Thank you so much, Dr. Duhan. Dr. Brewer, this question is coming in from Dave. Dave is asking, it's actually a comment. He believes that the media has hyped the coronavirus and the infection rate is really not that bad. His quote. Dr. Brewer, can you please comment on that?
So Dave is correct that we have not seen a lot of infections yet, but because this virus is 30 to 40 times more deadly than a typical flu virus, we want to get ahead and be prepared before it actually hits us, because if we wait till it hits us, it's going to be too late.
Thank you so much, Doctor. This coming in from Heidi. This is going to be for Dr. Duhan. Heidi would like to be able to know details of the new coronavirus case. I know that you're going to have to be able to respect privacy laws, Dr. Duhan, but I'm going to read you the question and then I'll allow you to answer as you see fit. Heidi, and we've actually now received, Carrie's telling me we've received 3 additional questions like this. Where is the person located? Where have they traveled? How many tests have been done so far? And how many tests are you waiting for regarding results? And when are those results expected? So I'm going to say these 4 questions one more time, Dr. Duhan. Where has the person traveled?
Okay. So, I am still, we just learned of this case. We know the case is in isolation. We know that they've been in one location. They did have exposure to someone with the coronavirus infection, and I'm getting the information as we speak about where that occurred, but it wasn't in our county because we didn't have any cases. So we are on this. We are tracking everything down, and I want to reassure the community that this individual is not out in the community spreading it at this time. Regarding the number of cases that we've done or tests that we've done, we don't know every test that's been done because that isn't mandatory reporting. What we know is the tests we've done, and we know the positive cases, which is 1. Public Health has done 3 tests, which have all been negative. Out in the commercial testing environment, which is clinics and hospitals, they've done 63 tests, and those negatively reported have been 28, and we're still waiting on the results of the remaining of those 63. So we have been doing our part to test in Mendocino County, and we only test people who have symptoms and who have not had other explanation for their symptoms, like influenza or a community-acquired pneumonia. So we've been tracking this coronavirus disease closely, and so far this is our very first test.
Thank you,
That's positive. The very first test is positive.
Absolutely. I'm going to go to our next question. This question is coming in live from Kent. Kent is asking, under the shelter-in-place rule, is it permissible for a couple to drive to the coast as long as they stay outdoors? And are you allowing people to travel to a second home as well? Dr. Duhan or the county administrator, would you like to be able to take that one?
So we are asking that people shelter in place for activities that are not essential, and it does the guidance in the order does allow for people to walk outside to exercise as long as they're 6 feet away from other people, and people are allowed to travel to their homes. So I think that when people read the order carefully, they will find that there's a great deal of guidance in it that will help them decide what is allowed and what is not allowed. But definitely it allows people to exercise in the outdoors as long as they maintain social distancing from other people and as long as they're not sick.
Thank you so much. This next question is going to go to Dr. Brewer. Dr. Brewer, this question has to do with tests. I'm going to read it verbatim. What the hell happened to testing in America? Dr. Brewer.
The short answer is we did not roll out the tests as quickly as we should have, and the initial tests had some problems with them. And it's just taking us a little time to ramp up our capacity. My hope is that within the next 2 weeks we will have the capacity we need to really track this infection.
Thank you so much. And that was from Jill. Dr. Brewer, I'm going to give you a second follow-on question. There's been a lot of debate that the United States, the Centers for Disease Control, should have gone with the World Health Organization test like most other nations, and that would have saved time and allowed for expedited testing. Can you comment on that and give us your opinion?
So hindsight is always 20/20. The Centers for Disease Control and Prevention are the best in the world at what they do, and I've been working with them for 20 years. They're really superb. They made a call. It didn't work out. If it had worked out, we wouldn't be having this discussion.
Thank you so much, Doctor. We're going to turn it over to the Dr. Duhan and the county administrator. Dr. Brewer, you can also comment on this. 2 questions. This is coming in from Jennifer. First question, can a person have both the flu and the coronavirus at the same time? Number 1. The second question is, can a person get the coronavirus more than once?
So, yes, you can have flu and coronavirus at the same time, but that is unusual. And at least right now, we do not think you can get it more than once.
Thank you so much, Dr. Brewer. Dr. Duhan, was there any other comment that you'd like to be able to have on those questions?
Only that is what my understanding of the data is as well, what Dr. Brewer just shared.
Thank you. This next question is going to be for Dr. Duhan, the Public Health Officer from Mendocino. This is going to go to the Superintendent of Schools, Michelle Hutchins. Superintendent of Schools, how are the high schools in Mendocino County going to keep track of student credits for graduation and keeping positive credits in the event that the shelter in place is prolonged?
We do not have that answer yet from the California Department of Education. This situation is unfolding daily. Right now, our schools are in the process of getting transitioning to this new way of learning, and we are awaiting that directive from California Department of Education.
Thank you so much, Superintendent. This is an issue. Had the time this morning. Very grateful to take some time with the superintendent to talk with each of the superintendents from across Mendocino County this morning, and this is an issue that we are following up on. I promise you that, and we'll be getting back to the superintendents here in the next 48 to 72 hours. This next question is going to go to the county. This one is coming in from Brianna. I'm wondering about shelter in place and how it affects exercising. For example, running on the headlands, haul roads, and other nature-dense areas. Is that acceptable or advised?
This is Dr. Duhan. I'll take that one. The order explicitly states that you may go outside for exercise, and including, taking your dog for a walk or taking care of your pets, as long as you practice social distancing and stay 6 feet away from other people. And thankfully, in our rural community, that is easier to do than those people living in the Bay Area. So, yes, it is allowed to go out and exercise as long as you're not sick. The order does say if you're sick, you do need to stay in shelter in place.
Thank you, Doctor. We are getting literally dozens of questions. Thank you. And I hope everyone is okay with us just doing rapid-fire questions. We want to get as many answered in the hour that we can. We're going to go to the next question. This coming in from Cheryl. This one is going to be for Dr. Duhan. Dr. Duhan, the question is, can you talk more about the April 7th date? How confident are you that we would not need to remain sheltered in place after the 7th?
Well, I set that date in the order because it matches the Bay Area, the big 6 counties in the Bay Area exactly. So we have the same end date as they do. And I would say that we will likely be impacted the same way they are. So we will follow closely what's happening in the Bay Area. And, the week prior, we'll be making announcements about continuation of the order.
Thank you so much, Doctor. This one is coming in from Elizabeth. Elizabeth is emailing in from Fort Bragg. If you'd like to be able to email your question in real time, it's senator.mcguire@senate.ca.gov. One more time, senator.mcguire@senate.ca.gov. We're taking your questions real time for both doctors, the county executive, and the county superintendent of schools. This one is coming in from Elizabeth in Fort Bragg. She is a resident of Fort Bragg, and then she's noticed that a lot of hotels and inns are full. Elizabeth says it concerns a lot of folks in town and on the coast and other places in the county because we're drawing a lot of visitors. Will tourists not here for essential business need to leave the county? Dr. Duhan?
Yes, in the order, we actually have a line that I'm going to read to you. For purposes of this order, this is the shelter-in-place order that goes into effect tonight at 10. For purposes of this order, the rental of transient lodging that is not for essential activities or essential governmental or essential business purposes is prohibited for the protection of our community and to ensure the community has lodging available if necessary for surge capacity and emergency purposes. So I am afraid to say that tourism to our county from people outside the county is prohibited by this order.
Thank you, Dr. Duhan. Dr. Brewer, we have a couple questions coming in for you. Why 65? Why not 60? Why not 55 as far as asking folks to be able to shelter in their home? Dr. Brewer?
So the question is correct. There is no sharp cutoff. It's a curve. And basically, the older you get, the more likely you are to have serious disease. So if you're between 60 and 69, your risk of dying is about 3.5%. If you're between 70 and 79, it jumps to about 8%, and over 80, it goes up to about 15%. So there's no sharp line, but where we see it going up is around age 65. So particularly under 50, we're seeing very low mortality rates.
Thank you so much, Doctor. We're going to stick with Dr. Brewer from UCLA Medicine. Dr. Brewer, this has to do with kids. Dr. Brewer, why aren't kids getting the coronavirus, or are they?
So kids are getting the coronavirus, but they're not getting sick. So when you look at data out of China, kids are as likely to get infected as adults, but they don't seem to get serious disease. And why that is, we don't understand yet.
Thank you so much, Dr. Brewer. We're taking your questions real time. Senator.mcguire@senate.ca.gov. Senator.mcguire@senate.ca.gov. This next question is coming in. We do not have a name on this question, but this is going to be directed to Dr. Duhan and the county administrator. Are the cannabis dispensaries going to be able to serve the medical patients for their needs in place order?
The answer is yes. This is Dr. Duhan. I'm trying to find the actual line item for that one. But let me get it. Agriculture, including but not limited to food and beverage cultivation, farming, ranching, fishing, forestry, livestock, and legal cannabis and other medicines are considered essential businesses. Again, what we're asking is that when these businesses sell the products that they sell, that they do it in such a way that there's something like curbside pickup. We don't want people entering shops and touching a lot of items and perhaps getting exposures.
Thank you so much, Doctor. Doctor, this next question is coming in from Al. Al asked the following: please have the Mendocino health officer explain why only 11 people had been tested and why she does not have access to testing in private labs. Is the info not available from the Centers for Disease Control?
Well, I'm afraid that listener misunderstood what I said. We have two avenues for testing. One is through our public health lab that's in Santa Rosa, and the other is through commercial testing. There's actually been 63 commercial tests done and 3 public health tests done, and we're getting results back over time. We have mandatory resulting to us whenever there's a positive test, so we are testing, and we are focusing our testing, however, on people with symptoms and otherwise unexplained causes of those symptoms. So we have had a lot of flu lately, and we have not been focusing testing for COVID-19 on people that have an other explanation for their sickness, like influenza. But we've done, actually it's 63 tests by now between the commercial and public health testing combined. Actually, 68 tests.
Thank you. 68 tests have been completed by the doctor and the teams that she's working with. Thank you so much. This next question for the superintendent of schools, Michelle Hutchins. This question is coming in from Rochelle. The question is, she's a Ukiah parent. How does her daughter pick up her school meal from Ukiah Unified?
Well, depending on, again, each one of the schools, I believe, is doing direct drop-off, and so the process would be to look at that school's website and get those direct instructions. We have over 40 schools in the county, and so there's going to be 40 different processes, unfortunately. So, yeah, each school's website will have that information. But mainly what they're doing is they're dropping off either at schools, and I do know that Ukiah Unified is also meeting students at bus stops as well. So the specific school's website will have the information that you're looking for.
Thank you so much, Superintendent. We're now going to be going back to Dr. Brewer. Dr. Brewer, this question is coming in from Alan. For people over 65, should we go to doctors and dentists?
So, obviously, if you have important medical problems that need to be treated or dealt with, yes, you should go to the doctor or the dentist. If it's an elective visit or something that's minor, I would recommend sheltering in place at least for the next 2 weeks while we're trying to slow the virus down.
Thank you so much, Doctor. This next question is coming in from Norma. Norma has some concerns about the county jails. Madam County Administrator, do you want to talk about planning for county jails and the virus?
Senator, I'll make a couple comments, but actually Dr. Doohan was at the jail today. You know, I think I'd mentioned that we have a very good working relationship with Sheriff Kendall, the Executive Office, and Health and Human Services. And I can tell you that they have been doing a lot of work in the jail, reducing their numbers, making sure they have enough space to isolate or quarantine if needed. I think Dr. Doohan might like to add to that.
Yeah, I was very pleased at my meeting today with Captain Pierce at the jail and you know, with the sheriff and regarding juvenile hall as well. They have a good plan in place. I was pleased. We do have the capacity there to house arrestees in a way, if they need to be isolation, that's safe. And we do have a good plan.
Thank you so much. This next question is coming in from Paul and Susan. Will counties receive aid from the state to keep things operational? Paul, Susan, yes. In fact, the state of California has advanced about $1.1 billion. A lot of that is going to go help county public health departments, counties, local school districts, and to be able to ramp up capacity in rural as well as urban counties across the state. In addition, counties are keeping track of their expenses associated with the response to the coronavirus. Do expect here in the coming months Mendocino County and counties across the state submitting their expenses to the federal government. This is a presidential declared disaster. Just last week, the president and when a presidential disaster is declared, the federal government opens up the Stafford Act. The Stafford account has $40 billion embedded in the account. It's continuously appropriated, and that money is going directly to assist local governments. It's on a reimbursement basis, but the County of Mendocino is tracking their expenses very closely, as they've done with each of the fires that we've seen. Madam County Administrator, anything else you want to comment on that?
Thank you, Senator. I concur with everything you've said, and we certainly are tracking expenses. I would also like to say that today when we did our first call with the business partners, and tomorrow we'll be doing a call again, is we are focusing on what do our businesses need, particularly with the shelter-in-place order. We have been working with West Company and EDFC, which are two local agencies here in Mendocino County that really are our economic arm. And we're looking at the Small Business Agency as well, SBA, helping us. We talked about that with the business community today. We'll talk about that again tomorrow. So not only are we working on trying to keep government going, but we're very concerned about the economics in the community and what we can do to help the business community. I've been talking with the city managers. I've been doing a call with them once a week, and we're trying to compare notes and stay on top of this. So thank you for the question.
Thank you so much. This next question is coming in from Katie. It's actually two questions. This is going to go to Dr. Brewer. Can you please once again go over the symptoms, such as does this start as a cold? And the second question is there's conflicting information about masks. Are masks good or bad for the coronavirus? Dr. Brewer.
Sure. Terrific question. So first, the symptoms. So unlike a typical respiratory tract infection, which is sort of runny nose and sore throat, COVID-19 is more of fever, myalgias, and cough. Dry cough, not really productive cough. So it doesn't look like a typical upper respiratory tract infection. Regarding masks, if you are healthy and asymptomatic, the only thing wearing a mask does means that we don't have enough masks in our hospitals and clinics where we actually need them. So please do not walk around with a mask. When we use a mask on a patient is when they're sick. So if you think you have COVID-19, you have a fever and a cough, call your doctor beforehand, and when they tell you to come in, they will likely put a mask on you and ask you to wait in a different area until you can be examined. So that's when you use the mask, when you're sick and you're waiting to be examined, or when a doctor like me or Dr. Duhan is examining a patient. But please do not walk around wearing masks if you're feeling fine.
Thank you so much, Doctor. We have about 5 minutes left. We're still receiving questions, rapid fire coming in. Want to say thank you to Carrie Lindecker, who is fielding those questions, getting them on a piece of paper, and we're making sure that we're getting them answered. So appreciate all of her work tonight. We're going to go to our next question. This one is coming in from Justine. This is going to go to Dr. Duhan. What agencies are responsible for enforcement of the shelter-in-place order?
Well, the order is enforceable by law. So if somebody were not to follow the order, there could be imprisonment or a fine. But we really are seeing this as an educational enforcement that the sheriff or local police might say, move along, please don't do this, please go back to your home or something of that nature. We don't want to see people being put in jail for not following this order. We want them to just change their behavior and be educated about why it's so important for our community that they follow the order.
Thank you. This next question is coming in from Lisa. Lisa is the Executive Director of the Mendocino Coast Writers Conference. What advice can you give us to how we should determine whether to proceed with our event or pursue postponement, rescheduling, or cancellation? That the conference is going to be held the first weekend in August. She's looking for an idea of a drop date in which they should make the decision about their first weekend in August date. Dr. Duhan?
Well, I'm sorry to say we just don't know. But what I will say is that I think we'll know a lot more by the time this current order, is at its stated end date. We may extend it. We may need to extend it. But I think when we get into early April, we'll have more of an idea of how long this is going to last.
Dr. Duhan, give us the reasons why you would extend.
Well, I think we would extend if we don't see this pandemic slowing down. If we see cases, we have one case right now. If we saw an expansion of the number of cases, if we saw community spread, if we saw that people weren't, actually doing their part to slow the spread themselves, and we needed to keep trying to push the epidemic back, the pandemic back. So it's really going to be based on the number of cases we have and how well we're containing it. That's how we'll make our decision. And also what's going on around us in the surrounding counties. We're all of the counties around are putting these shelter-in-place orders together. So we'll also be looking at what's happening in the Bay Area, Lake, Sonoma, Humboldt. They're all putting the similar orders in place.
Thank you, Dr. Duhan. We have time for a few more questions. We're going to have to begin to conclude here in a couple minutes. We'll keep asking questions at the very end, and then we're going to ask each of our presenters for a closing statement. This next question is coming in from Eleanor. She lives in Fort Bragg. Will gas stations be open?
This is Carmel. Yes, gas stations will be open, providing they have gas, providing that the trucks can get there and can deliver gas. And I say that only because we know that with PSPS, we had that problem. So they need the product and they need staff.
No, thank you, Madam County Administrator. And I want to assure folks that the county is in constant contact with the California Office of Emergency Services, and if there is ever a need when it comes to the issue of gas, for example, we will expedite gas shipping into the county who has need. But again, I assure you that we are in constant contact with the county on this. This next question is coming in from Jennifer. Can residential builders continue to work?
Yes, this is Dr. Duhan. That is included as an essential business. that we can continue having building move forward.
Thank you. This next question is for Dr. Brewer. Dr. Brewer, this is coming in from Julie. If I suspect that I have the virus, what is the process I should go through to determine if I am positive?
So, Julie, if you're otherwise young, healthy, and feeling fine, what you should do is stay home until your symptoms are all better. You don't necessarily have to be tested, particularly right now when we have a shortage of tests. However, if you notice fever or any shortness of breath, call your healthcare provider beforehand. Let them know you're concerned so that they can adequately prepare to take care of you when you come in.
Thank you so much, Doctor. This next one is going to Dr. Doohan, coming in from Sarah. Sarah's planning to see family in Santa Barbara. Are we allowed to travel out of the county under the shelter-in-place order?
Well, essential travel is allowed. If you're going to visit family and it's for essential reasons, then it is allowed. But, you know, we want people to shelter in place. I will tell you they're going to be sheltering in place in Santa Barbara as well. So the idea is get to where you're going and stay there and wait for this. And I want to share, that's what I'm doing. You know, I'm staying here while I have family in San Diego and in Seattle. I'm staying here for the duration of this pandemic. So we just need to shelter in place, stay where you are. But if you want to go and stay with your family in Santa Barbara, that would be essential travel.
Thank you so much. We have time for 3 more questions. This is now going to go to Dr. Brewer. Dr. Brewer, you mentioned that children aren't impacted the same, but what about kids who have compromised immune systems?
So immunocompromised people are always more susceptible to infections, so you will want to keep them home and away from crowds or places where they might become infected. And that's true regardless of their age.
Thank you so much, Doctor. We have a final question for the Superintendent of Schools. This one is coming in from Jesus. Jesus, Madam Superintendent, he's asking, since schools are going to be moving to distant learning, as opposed to suspending on-site instruction, how will the schools keep track of attendance for ADA purposes, and are districts communicating with respective teacher unions to make sure contracts are honored?
That is an excellent question. Thank you. Yes, our school districts are communicating with the teachers union currently. Those communications are happening today, yesterday, and the day prior. I will also say that the attendance requirements right now for schools have been completely relaxed. The attendance for schools is only going to be calculated up until February 29. Any day after that, the on-site attendance for schools really does not matter. However, the academics for schools still can matter. We're working out right now those details with California Department of Education to see if schools stay open and employ remote learning strategies, if that will allow for the academics to still count towards high school graduation.
Thank you so much. And we want to assure everyone who's with us tonight that the state of California is going to keep all public school districts whole. Whatever losses that they are facing due to the coronavirus, the state of California will be backfilling to ensure they do not see any impact to their ongoing funding. We need to make sure that we are focused on keeping our schools strong, and I just want to make sure we said that tonight. This is our last question. The final word goes to Ian tonight. Then we're going to ask each of our speakers to be able to give us a short closing comment. Ian is asking Dr. Doohan, he would like to know if and when more information will be released about the confirmed case in Mendocino County. Ian says it would be nice to know which community already has the virus in the area. Now, Dr. Doohan, just because an individual is in the community doesn't mean that we have community spread. It could, but it doesn't mean it. Can you clarify that, Doctor?
Well, that's correct. This individual actually had, contact with someone with COVID-19. Community spread is when we start to not know where the person picked the virus up from. I am not able to disclose this at this time because we just learned the information, but I would expect that it will be public information by tomorrow, just by the nature of how information spreads in our communities. We are having a press conference tomorrow at 4 o'clock, and at that time I will be more free to speak about details of this case then.
All right. I really appreciate it. First and foremost, we want to take a moment to say thank you to everyone who has been tuning in tonight. We are so grateful that your willingness to be able to work with us on this telephone town hall. We had an amazing response, and we'll be back with you, I promise, with additional telephone town halls in the week ahead on the coronavirus response. What we'd like to be able to do now is to provide each of our presenters with a closing statement. We're going to start from the bottom and work our way to the top. We're going to start with our Superintendent of Schools from Mendocino County, Michelle Hutchins, with a brief closing comment. The floor is yours, Madam Superintendent.
Thank you very much. High schools recognize graduation requirements are a big concern. I meet with the public school leaders every day, and together we are working on solutions so that our seniors remain on track. Schools today do not have all the answers, as this situation is ever evolving and at an extreme rapid pace. But what we do commit to is working closely with our public health officers, our local government, our state senator, and our public to make sure that we have the best minds behind and get the best solutions for our kids. So I thank you, Senator McGuire, for the opportunity to speak for the schools tonight.
Thank you so much, Madam Senator. We're grateful. We are now going to turn it over to the county administrator with a brief closing comment.
Thank you, Senator. Thank you very much for this opportunity to participate in this town hall. I hope that we can do it again, maybe at the close of this event with better news than we have this evening. I would like to say that Mendocino County has a call center. I would like to give that number in case there are members of the public out there that don't have it. That number is 707-234-6052. 707-234-6052. That's our call center. It is open 8 a.m. to 5 p.m. 8 a.m. to 8 p.m. We've changed the hours. And if you call after 8, it rolls over to dispatch. So you can leave a message. If it's something urgent, we could get a live person to talk with you and answer your question. We also have an email, and that is callcenter@mendocinocounty.org. And that email goes to the call center. And there are people there that will respond if you can't call or don't want to call. So, again, I think that Mendocino County, workforce of 1,200, we are doing everything we can to serve the public. We're also doing everything we can to protect our workforce so that we can provide the essential services we need to provide to our residents during this time. So, again, Senator McGuire, you are always there for us and for Mendocino County, and I thank you.
Thank you so much, Madam County Executive. You do a fabulous job, and I also want to say thank you to the Mendocino County Board of Supervisors who have been through so much, just like every other resident over the past many years, and for all of their hard work. We're going to give the last word here to Dr. Duhan, then we'll turn it over to Dr. Brewer. Mendocino County Public Health Officer, Dr. Duhan.
Thank you, Senator. I hope that this event was informative for the listeners. You know, a public health officer has two tools to fight a pandemic. The first is containment, and the next is mitigation. For mitigation, we're sheltering in place at this time. We're finding alternative housing. For containment, we need testing capability. And I'm sad when the listeners asked how many tests we've done. And to summarize, we did 63 commercial tests through the practitioners in the community and 5 public health tests. That's not enough. And I'm really hoping that we can open facilities like drive-through testing in our county. And I'm really hoping that we might get support from, the CDC perhaps to support us to do this testing, because we are still early in the phase of the pandemic reaching us. So I would like more tests, and I'm hoping, I know that many other counties do, I'm hoping that we'll get them soon from the powers that be.
Look, Dr. Doohan has been working literally 24/7, and I just want to acknowledge her incredible work. She has a lot of long days ahead, but we are in good hands, and I just want to say how much we appreciate your amazing efforts on behalf of Mendocino County residents and helping to keep us safe. Dr. Doohan, we're very, very
Thank you. Thank you, Senator.
And we now would like to be able to give a last word here to Dr. Brewer from UCLA Medicine. Doctor, you did a fabulous job tonight. Thank you for bringing your expertise to the call. We'll give you the final word.
Thank you, Senator McGuire. First, I realize we could not answer all your questions. I apologize, but the U.S. Centers for Disease Control and Prevention and the California Department of Public Health have excellent websites and resources on COVID-19, and I would encourage you to rely on these reliable sources rather than other social media to learn about the virus and what you need to do. Secondly, you cannot get COVID-19 over a telephone. As you shelter in place, reach out to your neighbors, particularly people who are living alone or are elderly. Just check in on them and make sure they're okay, because together with knowledge and helping each other out, we will get through this like you have gotten through the other crises before.
Thank you so much, Doctor. We're grateful for your work. Know that you have been so incredibly busy working the floor of the hospital, and for you to join us tonight, it's a great honor. Thank you, sir. Our number one goal for tonight was to provide timely and accurate information and to try to get through as many questions as possible, and we hope that we were able to satisfy many of you, and I'm sorry that we didn't get to all of the questions, but we know that there is great interest, and we will be back with you with another telephone town hall here in the weeks to come in Mendocino County. I'm just going to finish with this. There is no doubt that our social and civic life has been dramatically altered. Thousands upon thousands of Mendocino County residents and millions of our neighbors across the state are sacrificing significantly, shutting down businesses and group gatherings and travel. It's nothing that any of us would want to do. And I want to take a moment to say thank you for stepping up to be able to do the right thing when it comes to public health. And I'll also be honest, we need to learn from other nations. These closures are the best way to be able to defeat this virus.